I am an analyst for the California Department of Aging in the Aging and Disability Resource Connection Bureau. My pronouns are she, her. I have brown hair, and today I am wearing a black floral shirt. Thank you all for taking your time to be here. Just a few notes before we get started. If you are dialing in, please dial *9 to request to be unmuted, and then *6 to unmute yourself to speak. You would then dial *6 to mute yourself again. Chat is enabled for you all today to post questions or comments, and you can also use the raise hand function. We have also closed captioning for this meeting. To enable this function, select live transcript or closed captioning in your Zoom toolbar. And we are recording the Zoom meeting today. If you're having any technical issues with Zoom, please email adrc@aging.ca.gov. Now I'd like to introduce Wilson Tam, ADRC Bureau Chief.
Hi, good afternoon, everyone. My name is Wilson Tam. I am American of Chinese descent. I have black pointy hair, glasses, and I'm wearing a blue button-up shirt today. Just talking about, I've always, believe it's important for us to know why we do things rather than, just what we're doing. And so I just want to briefly cover about why we are collecting the data that we're collecting. And one is to really demonstrate the value of our ADRCs. And understanding that it's a challenge for us Californians to know what services are available and how to access those services in order to maintain our own independence. And so we really need to demonstrate and make it better known about the value of ADRCs, our ADRCs, in supporting individuals in navigating and accessing those valuable services that each of our organizations provide. And secondly, it's important for us to really, data helps us identify the community needs, but just as important, what are those service gaps that we should be addressing? In addition, data helps us identify the populations we're serving, and on the other hand, those that we're not serving as much and should be outreaching to. And third is the why is to really show consumer outcomes. As you know, in the past, most of our programs, whether it's Older Americans Act or independent living programs, we've collected data on outputs, such as service units and consumer demographics. However, with recent research on social determinants of health and also the growing importance of demonstrating outcomes to funders, we really need to start collecting data that not only measures the outputs, but also just importantly, measuring the consumer outcomes and how we improve the lives of those that we serve. So that way we can not only improve the lives that we serve, but also better position ourselves for future funding opportunities, especially with healthcare entities and healthcare programs. And fourth and last but not least, is data drives action. Data enables the state and our local partners to determine how best to focus our time and resources, including supporting the need for continued and or even increased funding if we can demonstrate that there is a need for it. So with that, now that we've talked about the why we're collecting data, I do want to recognize how we've made improvements to our data. I want to recognize our state's ADRC Advisory Committee that has been instrumental in supporting our data improvement efforts. Without further ado, I'm going to turn it over to our next speaker, Letty Zuno, who is a member of our ADRC Advisory Committee and the chair of the committee's Data and Outcomes Work Group. So Letty, take it away.
Hi, Wilson. Thank you for that introduction. Good afternoon, everyone. I'm Letty Zuno. I'm the Executive Director of Access to Independence of San Diego. I am a woman of Hispanic descent. I have very dark hair, and I am wearing a white top with blue embroidery on it today. And I'm really excited to be here today and take a couple of minutes of your time to talk about, maybe more than anything, add on to what Wilson said about data. And so why do we do this, right? Why is data important? And I think for all of us here, and it's so great to see so many people in this space wanting to talk about this topic. I think to me, data is communication, right? It's a communication tool that we use across the spectrum. So from the immediate data collectors, so it could be the ADRC coordinators or case managers, those extended partners, when they are in those initial conversations or initial dialogue with the people in the community that are wanting services, that are needing something, requesting something, and are communicating those needs, where we start immediately collecting data, right? We could collect it mentally first, or we put it into a system to collect demographic information, to start capturing needs. We're communicating that, we're capturing that. And then in turn, we turn that information, that piece of communication, over to the ADRC or over to a funder. And it's in that process that, to me, data is the most critical communication tool that exists. And if we look at every aspect of lives and what we know about communication, right? It's the key to solving all the world's problems. If we communicated better, we would avoid a lot of misunderstandings, a lot of losing people sort of in service gaps across the board, in our personal relationships, in work relationships, and in the data collection piece. If we could, how we communicate, if we communicate well, if we communicate effectively, we can sometimes get more money. We can make our case to funders, and we can also make sure that the people that are seeking services receive those services in a manner that's that has quality, and that we can also report back and see those outcomes that we're looking for. So it's been really exciting being a member of the data work group. A lot of people that are just as excited about data. We do recognize that we're always looking at different ways, more methodologies in how we ask questions. We spend a lot of time looking at the value behind each and every question that we're asking. It has a story behind it, and what we really want to demonstrate. We're always talking about, how do we tell the story of our community, the people in our community that are the most fragile, that are the most vulnerable, and how do we best tell that story? Data is the answer really to that, and how we communicate it. So thank you all for being here again and listening to me ramble about data. I get very excited talking about it. So welcome everyone. I'm excited for today's call.
Thank you, Letty, and thank you, Wilson, for sharing your thoughts. So my name is Amanda Price, and I'm the Research Data Analyst for the ADRC Bureau. And it's great to see all of you today. As Letty said, we're all excited about data. So it's really nice to see your names and faces. I am middle-aged Anglo with long blonde gray hair, and today I'm wearing a dark gray button-down shirt. So we have some information to share about the updated ADRC service report today, but also I wanted to touch on some requirements for ADRCs and talk about the bigger picture for ADRC Bureau data collection. So first, an overview of the requirements for designated ADRCs. So these requirements include the completion of program goals and objectives to expand and enhance ADRC services, submitting quarterly service reports, these data reports we're about to talk about, and also for applicable funding sources submitting a budget, expenditure processing, and closeout reporting. Also, a clarifying note on the service data report itself. There have been some questions about the data that should be reported in it. So this report is not tied to any particular funding source. So it's not tied to the infrastructure grants. Some ADRCs may have assumed that to report only consumers that they have served through the grant, but that is not the case. It's for all consumers served by the ADRC. So for the next slide, if we can get to that, this is just an overview of this fiscal year's data collection and reporting. Designated ADRCs will submit quarterly service data reports, and that data is cumulative throughout the year. And you may have heard in previous updates and webinars that there will be a beta test of a consumer experience survey in October and November for designated ADRCs to be participating in. So there'll be a training and tools delivered on that soon, so stay tuned. And emerging ADRCs for this fiscal year will submit quarterly work plan updates. And in the fall, they have the option to participate in the consumer experience survey beta test. For recipients of the ADRC CARES Act funding, there's a final data report that will be due in October and a final rapid assessment in October. And then recipients of the ADRC vaccine access funding will file a final data report in October. So we've compiled all of these deadlines into a calendar, which will be sent out to you soon. So stay tuned for that as well. So first, before we get into some of the report itself for this year, I just wanted to share a little history on how we've gotten to the place of having a newer and streamlined service data report. In fiscal year 2021 and 22, the quarterly service data report was evolved from the previous years to which collected overall service data to measuring consumer outcomes more closely, a little bit more towards the goal that Wilson and Letty have described about just getting that, getting more consumer outcome focused. So this evolution involved a process of developing logic models to help identify key data and information requirements to assess those outcomes, and then program inputs and outputs, activities, and immediate, intermediate, and long-term outcomes were identified in that process. So then key data points and measures were identified in order to measure the impact of ADRC systems and consumer outcomes. Then the fiscal year 21-22 report had several new data element collection points in it, and ADRCs were invited to collect the data, and the do not collect option was also available as ADRCs began to put their data systems together to collect the new metrics. So this past year, as the report has been submitted by designated ADRCs, they gave input, all of you gave input as to how the data collection was going. And the ADRC data team also sought input throughout the year and kind of going out to each of the ADRCs to see how things were going. ADRCs also gave further input in a data workshop that was held in January. And then the ADRC data team researched current state and federal regulations and assessed the data coming in as well. The team also worked with the ADRC Advisory Committee Data and Outcomes Work Group on recommendations to adjust and evolve some of the data elements collected. And in July, the new report was sent to all of you, to all of ADRCs, and also a fillable version is being worked on and will be sent out soon. To see the report and instructions, you can also visit the ADRC Partners and Providers webpage, or to receive it again by email, please email us at adrc@aging.ca.gov to receive a copy of that report and instructions. So now that we've talked about the bigger picture of where we've gotten for this new data report, let's talk specifically about the enhancements that have been made to the report. And the next slide. So the report is streamlined in measuring service statistics and benchmarks. It's been adjusted in some key areas. Some of the data point definitions are clarified and streamlined. The report has some optional notes sections for ADRCs to add notes about data collection. And some data points have been modified to align with the state and federal regulations, as I mentioned. And also the instructions for the report include definitions for some data elements that were shown to be challenging for some ADRCs to collect and define. So we hope the new report for this fiscal year will support ADRC data collection reporting, and we look forward to a continued conversation with all of you about the new report. So I just want to pause here, see if there's any questions before going into the enhancements to the instructions and the rest of the report. Please unmute yourself or raise your hand. You can also kind of enter questions and comments into chat as I talk on about the report for a little bit. So the first area that we worked on for enhancements was the instructions. So just a note, do take time to read the instructions if you haven't already. You'll be glad you did. There's a lot in there now that's clarified and hopefully will help you in the data collection. So the instruction document overall was reorganized for easier navigation. On the first page, there's clarification on the do not collect box versus no data versus zero data. So even though all data should be collected, we realize some ADRC data systems are still evolving, or that data just isn't collected by a partner. And so when no data is collected, please check that box. Don't leave a blank in the number field and the box unchecked. So one of those two fields should be filled in. And then if there is zero for zero consumers served in that data point, enter a 0 into the numbers box. So this year, as we see do not collect as indicated, we will also be following up more with individual ADRCs in their reports. So we look forward to that conversation. And thanks to ADRC feedback, there's also an optional notes section at the end of each part of the report. So as the data reporters are filling in the report, it's a nice way to add additional information about data collected and reported. And I'll go through some of those sections in a moment. Another adjustment to the instructions is the data elements definitions, and those are at the end of the instructions page. And service function and outreach data element definitions have been enhanced and streamlined. So take a look at those. And we'll go through a little bit more of those in a moment. Next slide. So the first page of the data report, the new one, it looks similar to the previous, where you'll fill out the core partner information. And I just wanted to highlight a little bit on the extended partner section. It's now been adjusted to include not just the list of extended partners who are reporting data, but also the service functions offered by those extended partners. So this will help help us and all of us understand the roles of extended partners in those services. And next slide. So moving through the report now, under the demographics section, there are a few adjustments in this section as well. So aligning with some of the revised state and federal regulations, there are adjustments in the following sections for demographics. Race and ethnicity has now separate categories for ethnicity and consumer race. And then additional selections are now available for consumer gender identity and consumer sexual orientation or sexual identity. And there's also at the end of that demographic section, one of the optional notes sections for data reporters to enter additional information. And then the next section is the service functions for ADRCs. So those service functions are enhanced information and referral, options counseling, short-term service coordination, and transition services. And previously, each of the service functions that collected the data point called total follow-up calls made and then total follow-up calls completed. This has now been revised to be total follow-up made and total follow-up completed to be more all-encompassing. And then another adjustment in each service function, there was a data element called action plans developed and action plans completed, or just plans developed and plans completed. So that data element is now streamlined to be the same for all 4 service functions, plans developed and plans completed. There's also more of a definition of plans in the instructions document. Another adjustment in the data point of actions or goals, those were, depending on what service was being offered, one of those 2 choices were there. And so for this fiscal year, these data elements have now been streamlined across all 4 service functions to be total actions developed and total actions completed. And then these data points are also detailed in the instructions document. And those 2 data elements, actions developed and completed, are also optional elements to be collected this year. And this was in response to ADRC feedback regarding collection of that data. So for the next section, we'll move on to outreach activities. So in the previous report, this was outreach and enrollment activities, and it's now streamlined to be called outreach activities. And this change is based on feedback from ADRCs as well. And it now collects 3 elements: number of outreach activities, number of people reached, and number of application and/or enrollment contacts. So the instructions are also detailed in the definitions, in the definition for this area. And again, there's a notes section to detail additional collection notes for reporters. The next section, there's another section that is filled out only at the 6 and 12-month reports. One update within that section is the ADRC Infrastructure Work Plans and Goals update. That's filled out in those 2, the 6-month and the 12-month reports. And it is aligned now to the new ADRC program narrative form, which is CDA 7039, which all of you are familiar with. So that's another adjustment. So I'll kind of pause here. That concludes the report overview and the enhancements and changes. So after the ADRCs submit reports, what happens? I thought this would be just helpful, just follow up here. The ADRC will follow up with ADRCs to confirm the data that was submitted and to gain a better understanding of the information that was submitted. And then after that, the identified trends will help give an overall view of the ADRC program. And that data is also shared with ADRC partners and leadership to help inform the program in the future. Kind of closing that loop again to continue improvement and changes when needed. So I know that's a lot to take in. We're now at the questions and comments section at the next slide. Thank you all for your feedback throughout the year and participation in submission of your data. And the data that your ADRC collects and reports really demonstrates the impact of lives across our state with ADRCs and that impact. So thank you. And at this point, if there's any questions about the report or instructions that you've come across or general questions and comments, we can just address them now. Please unmute yourself or raise your hand or enter any comments in the chat. And I see one right now, Anna Swartz. Hi, Anna.
Hi, I'm so sorry that I was late. We had to restart our computers right when this was going to we had to restart our server. Question on the ages. Is there a way that we can get it more streamlined for to be able to do the same thing with the state? Because they're not aligned with the same quite, and so like it's harder for us to do. Like, we have to do like separate things. You know what I'm talking about? Like, is there an option of? Is there maybe a way to get that done?
Thank you for that comment. We can take a look at that. Are you part of an ILC or?
Yeah, I'm an ILC in Worker Community Access Center in Riverside, California.
Great. Yes.
Yeah.
Okay. Thank you. Thank you for that comment. Yeah, we can.
Also, the original report that you sent us is not fillable. Are we gonna get fillable reports, or how does that work?
Yes, we will be. We'll be sending that out very soon. So it is not fillable yet.
Yeah, no, I was like, well, okay, it's not fillable. Okay.
Not yet. It will be very soon. So thank you. I see Marco, you raised your hand.
Yeah, this is Marco from Orange County. I just had a question on the CalFresh outreach, because we are going to have some funding in October specific to CalFresh outreach that is going to be geared towards outreach and application assistance for older adults only. Can we count that in both? Because I know they're asking for data as well. Can we count it as ADRC as well, though?
So yes, in the outreach activities, we do ask for CalFresh as well as some of the other programs. And it's just helpful if it was through the ADRC that the outreach was done, then you can count that, yes.
Okay, thank you.
Yeah, no problem. Fanny, I see your hand is raised.
Yes, hi, this is Fanny Lapitan with San Francisco. Just wondering, I'm actually new to my role, so I would love if the slides can be shared with me via email so that I can refer back to it in case questions come up.
Yes, both the slides and recording will be shared after this. So thank you.
Thank you so much. Thank you.
No problem. Rhoda, I see your hand is raised.
Hi, thank you so much for taking the time for this discussion and sharing these details. And of course, thank you, Fanny, for the question of getting this shared as well. My question or clarification you mentioned earlier, Amanda, was data collections. Let's say you're not an ILC and you're not a AAA where you can serve anyone, doesn't need to matter if they are disabled or not. It could be like a 2-in-1, for example, correct? So it could be you're serving someone, it's a 14-year-old that calls, but they're not aging and they're not disabled. But are we asked to be gathering that data too? Or we're just asking to get the data for those that are seniors that we're serving throughout our agency and those that are disabled throughout our agency. Is that correct? Given that we are an ADRC. I just needed that clarity.
Yeah, the data or data reported would be consumers served by the ADRC. And it is for, as you mentioned, those qualifications. So like the 211 for like all consumers served wouldn't be reported.
Wouldn't be included. Yeah. Okay, perfect. Thank you. Because I'm like, hold on a second, that'd be a humongous number.
Yes.
But definitely the ADR, when you say ADRC, then we are just looking for that criteria, those that are self-identify themselves as seniors or disabled no matter their age. And those are the ones that we would count.
Yeah, and Rhoda, we can probably talk offline too, because I want to make sure sometimes it's also how they kind of come into the ADRC that it could be counted differently. So we can follow up too. I'll make sure to do that.
Okay, great. Thank you.
I see there is a question in chat. Sorry, I can't read it all the way. Jaden, I see you had sent something. Categories added. Oh yes. So the new categories for race and for ethnicity are lined up with the state regulations there. So I agreed it could go in a lot of different directions, but we're aligning with the state regulations. Let's see. Oh, and thank you, Anna, for your clarification on the reports for DOR and the ILC side. Thank you. I appreciate that. Hannah, you had your hand raised, I see again. Do you want to add
Thank you.
anything?
So with the races, we only ask each of the Pacific Islander, so how are we gonna know? Like I said, I was late, so I probably missed some of this, but I just want to make sure that we're doing this right. So how are we gonna know who's what? Because we our end, we only ask Asian or Pacific Islander.
So I think it'll depend on your protocols within your ADRC. So you go with what your ADRC is determined for that. That's right. Yeah. And in the data collection notes too, when you fill out the report, you can add that in too, just so then we're aware.
Okay.
Yeah, thank you. There additional comments or questions? Liz, I see your hand raised.
Thanks. I had put it in the chat, but I think you've gotten a lot of stuff in the chat since then.
Okay, probably.
we were just having a meeting actually with the Placer ADRC, and we were looking at the form. And one of the questions that came up was, what if someone's status changes over the course of your work with them? You know, so there are characteristics that you ask us to report, like housing status and income status and some of those things. And what if through your work that changes? Do you count them in, how do you count the person? Do you count them as what they were when they started or as what they are right now? And is that going to be confusing because they'll be counted in two different places in two different quarters?
So yeah, and some of that I know we don't ask in the ADRC report. So going with what your protocols are, I would say would be the best answer for that. Again, it depends on how your ADRC kind of processes that data, but the updated reports can enable you to do the most recent qualities of that person. So if they, even if they change birth date from Q3, they were 64, and Q4 they were 65, you'd report them in the 65 category when you do the new pull of data, if that helps.
Thank you.
Sure.
Where do I do that?
There
sorry,
anything
question.
else? Oh yes, Brigitte, is that you? Oh, sorry. Yes. Hi.
Hi, actually, it's me, Vicki. So I do have kind of an old school quick question. Is there any way that we can be given like a list of what not to do, or maybe in a more positive way, what we should do and examples of that?
In terms of data collection or polls or?
Yeah, I mean, you know, maybe, you know, an example by what you already know of you know, reporting, you know, seeing something that is done by many of us and knowing that that's not actually the correct way to do it to get proper data.
Mm-hmm.
Yes. And then maybe that writing that down and sending it out just as a cheat sheet of what not to do.
Great comment. Thank you, Brigitte. I can see what we can do. And also, we have discussed data collection in some of our roundtables before. So, you know, as those evolve, we can even kind of just bring that kind of stuff up in kind of a peer roundtable format as well. So thank you for that idea. Jaden, I see your hand raised.
Yes, hi, thank you, Amanda. My question revolves around the differentiation in enhanced INR services between total warm transfers versus total service referrals offered. Can you touch on the difference between those for me, please?
Yeah, and there are better definitions, I think, in the instructions. So I think probably the best is to refer to instructions. And then, Jaden, you and I can follow up with a call based on what your specific ADRC does, and we can maybe clarify a little bit further there. That might be the best route. Yeah, no problem. Of course. Thank you all for this feedback and comments. It's been really helpful. Stephanie, I see your hand raised.
Yes, can you hear me?
Yes.
Sorry, I don't know if this was already answered, but is the primary format of the report, like, is the template just a PDF?
Great question. It is a fillable PDF, or it will be fillable soon. We'll send that out. It is a fillable PDF for just overall accessibility. We can produce other versions. So if there's a kind of a better way your ADRC would be able to report the data, please email me, or the ADRC inbox is fine. And we can work with you directly on getting a report version that's better for you.
Okay, yeah, I was just wondering if there was like going to ever be like an Excel template maybe or something.
Yes, that can be produced for you. Yeah, no problem. Yeah.
Awesome. Okay, thank you.
Sure. Yes. Thank you all. Great feedback and questions. Anything additional coming up for you? Don't see anything yet. And I know, and I've taken note of some follow-ups for some of you. And also, please do send an email to adrc@aging.ca.gov, and the data team will take your questions as they come in. We try to respond very quickly. So we'll have also further opportunities to connect about data and reporting throughout the year with each of you. So we'll look forward to that. Chris, I see your hand raised.
Hello, Amanda. Thank you. Just a question. I know for us in our ADRC, we are still working with our program, our database program, and still trying to dial in a few of those categories that we haven't been able to collect on yet. Are we still okay as a designated ADRC to report that we aren't collecting on that yet? We're still working on it, or is there a deadline that we have to have those in play?
Yeah, there's no deadline. Great question, but we do note those data do not collect, and so we will follow up with you in our kind of quarterly meetings about data with you to continue to talk about that. And we also, for the data collection notes section, it is optional in the report, but you can put that in that note. Just say, we're still trying to collect these elements in this section. So that's helpful too.
Okay, perfect. Thank you, Amanda. I just want to make sure that was okay to do.
Absolutely. Yeah, thank you. Is there anything else coming up for any of you? Well, I know we can stay on the Zoom for a little longer if any of you have other questions, but I want to make sure to be conscious of all of your time. Thank you for taking the time today to listen to all of us and to care about data as much as we do. So thank you. And we'll be following up with an email with a recording of the presentation today and the slides themselves. And then do look for that fillable report very soon too. So thank you all for joining today. So if there's nothing else, I hope you have a great rest of your afternoon.